Hello everyone, welcome back to another virtual live behind the scenes tours and field trips. My name is Chris, this is Aaron, and we are here at Advent Health Celebration and the Baby Place.
The Baby Place.
Learning all kinds of things about what goes on in the Baby Place and all the amazing careers in the Baby Place. So now that I'm done saying the Baby Place that many times, I'm going to toss it over to Aaron.
Hi students of Osceola School District, glad to have you here again for another virtual live. Today it's fascinating. You're going to get to meet some really great people, and this week it's Nurses Week, and so we are here celebrating nurses and all that they do, and today the Baby Place is where our focus will be. I am with today not Sarah. Woo! Who am I with today? Candace. I'm with Candace today, and Candace is here today to talk about all of the wonderful things that happen at the Baby Place. Candace, can you just introduce yourself? Tell us a little bit about what your role is here, and what was your educational path?
Okay, I'm Candace. I'm a labor and delivery nurse here at the Baby Place, Advent Health Celebration. I went to school at University of South Florida for 2 years. I finished up my degree down in West Palm Beach Atlantic University. So a total of a 4-year program. I have my bachelor's in science nursing, and I've been a nurse now for 14 years.
Wow, that's a long time. That's a big career. Did you start out in labor and delivery nursing?
I did not. I started out in medical surgical nursing. My mother is now a retired registered nurse as well, and her advice to me at graduation was start in med-surg, and then you could branch out from there. So that's what I did. Med-surg for a couple of years. I did some orthopedics, some general surgery, and then I found myself on labor and delivery.
Right, real Jill of all trades.
Well, I think that's the fascinating thing about nurses is that you can go into different areas and explore. You're not, some nurses stay in one area for their entire career, but with nursing, there's so much that you can do. So I think we spotlighted a lot of that in our virtual lives in every department that we've gone in.
Yep.
Well, now I'm excited. So tell us about where we are. What is this room used for here in the Baby Place?
So this is a labor room. We do all of the laboring process from the time a pregnant mother is admitted to the time that she delivers. And then she will recover in this room after the delivery of her baby for 2 hours, a minimum of 2 hours, until we transfer her to the other side of the unit, which is called our mother-infant unit.
So what's some of all this stuff that's lying here? Is this for the mom?
So this is for the mom. We've got a gown. We've got some non-slip socks for her. We've got these 2 nice little bands because our moms are not our only patients when we come into this room. They have a baby in their belly or babies in their belly. So we have to put the mom on a monitor, electronic fetal monitoring system that lets us see the baby's heart rate, and that kind of determines our care for that mom and that baby, depending on how well the baby's responding to labor.
So I think that this makes a unique side of nursing, right? That you're taking care of 2 people, or sometimes 3 people, depending on if mom's having more than one baby, right? So how many babies are delivered here on average, like every month?
Approximately 300.
Wow, 300 is a lot.
Yeah,
that's a lot of babies.
Yeah, so we're typically very busy. We see a lot of turnover of our rooms. Oftentimes, if we're laboring one mom, we could potentially be laboring 2 at the same time. Once they deliver and we do the recovery and we give report to the other side of the unit, we'll often come back and have another admission waiting for us. Just have a lot of moms having babies right now.
So those monitors back there, I know we can't see too much over there, but those monitors are monitoring babies all over the unit, correct?
Yep, so we have this is the electronic fetal monitor right here. It does multiple things for us. We've got 2 parts here. One is the ultrasound transducer. This is what detects baby's heart rate. And this other one is the tocodiameter, and this is what detects contractions. So this will tell us how often the mom's contracting and how long those contractions are lasting.
So what are contractions?
Contractions are the uterus.
No, that's fine. That was cool.
Yeah, there's helicopters in the background.
This is a working live hospital.
Right. Contractions are how the cervix dilates. I'm really not sure how far to go into all this.
No. So let me help you.
Okay.
So the uterus is where the baby is living and
Okay,
growing
there you
inside of
go.
the mom,
Yep,
right?
yep.
And the cervix is sort of the doorway that the baby will come out of, right?
Okay. Yep, that's exactly right. So contractions are the way that doorway will open enough for that baby to come through and be delivered.
Oh, that's really awesome. So that machine, what did you call that machine again?
It's an external field monitor machine.
And we'll pick up those contractions.
Yep.
How hard that uterus is working to make sure to get the baby out. And then the other one.
Basically, and the other one is going to monitor the baby's heart rate. So then if baby's not responding well to the contractions or something that we're doing to help those contractions happen, we'll be able to see it on the monitor and react to help baby out, because baby's habitat is inside the uterus until they're born. So,
Right. So what is this next to then?
So then we have, let me turn this on. We have pumps. I'm trying to think of the correct term.
So they're IV pumps?
IV pumps, yes.
Okay.
That
So
works.
intravenous, because this is something that would be connected to mom in her vein, right? In her
Correct.
hand.
Correct.
And you could give mom all the types of medicines that they would need.
Right.
If they needed it.
Right. After she has an IV in place, of course.
And then what about over here?
We have a baby warmer over here. This is what's used at delivery. What we'd like to see happen is baby goes skin to skin on mommy's chest right at delivery, and that'd be all we need to do and never come over to the warmer. But when baby comes out, if baby's struggling a little and needs a little assistance to help breathe, this big old contraption can provide that for us. So we've got oxygen hookups, we've got bag and mask that we can use.
Yes, they have
Lots of
everything in
stuff.
case the baby may be struggling, right?
Yep.
Because it goes from getting all its nutrients and oxygen from its
Exactly.
mother to, hey world, here I am,
Right.
I gotta do it on my own, right?
Exactly.
So that's cool. So this is all set up for the baby, and then obviously this room is really set up nice, right? It's a place for families to be,
Correct.
because it's a family event.
Correct.
And so that's really nice that that this is here. It can be all in one place for the comfort and safety of the mom.
Yep.
Well, thanks for showing us around the room today.
My pleasure.
Now, I have one question. I noticed that there's a lot of windows. These are for when the stork comes and brings the baby.
Yes,
correct?
Tyler,
I
that's
thought
it.
so.
You got it.
All right,
You
that's
got it.
what
When
I
the
thought
stork
so.
arrives.
Well, or it's delivered by helicopter.
The helicopter outside. Yes, of course. That's exactly how it happens.
Okay, I thought so.
All right, thanks, students. Welcome back, students. I'm here with Sarah, and Sarah's going to tell us a little bit about her job role here at Advent Health Celebration. Hi, Sarah. How are you?
Hi, I'm good, thank you.
Thank you for letting us come in to see about what you do. Can you tell me a little bit about your role here?
So I'm the surgical technologist for labour and delivery. This is our OR. We help to deliver the babies when moms have had a cesarean.
So this is where they actually perform surgery when mothers can't have a vaginal birth. Is that correct?
Correct.
And so is that bag behind you some of the instruments that you may set up for this procedure?
Yes, that's right. So inside the bag is a tray and lots of instruments that may or may not be used for this surgery to make sure that we can pick.
So during surgery, do you actually make sure that the right instruments are cleaned and that they're ready to be used for surgery? And is that correct?
Yes. And when the surgeon does the surgery, he asks for certain types of equipment, and we pass it to him so that there's no delays. It's quickly done. And then we make sure that each instrument is cleaned and put back on the table just in case they need it again.
Wow, that's a pretty big role. And so how long did you have to go to school for this job?
I spent 18 months in community college to get my associate's degree, and the course was a certified surgical technologist course.
Yeah, so that's not too long, but to go to school, but for a really important job, and you get to work in the operating room every day.
It really is a very important job. We wouldn't be able to do our surgeries as efficiently for both the mommy and the baby without the surgical technologist's role.
So can you tell me a little bit about the operating room? It looks like there's lots of big machines in here. Do you, as a surgical technologist, do you do any of these machines, or is that for the nurses to do?
So if you start over here, the surgical technologist would use all this equipment. There's a little tray there for the instruments that are used more frequently. This is your big serving table, if you like, which has all the equipment on that may or may not be used. This is suction, just to get some of the blood and baby's water out of the way so we can see properly.
What about the machine behind? Is that a sterilizing machine?
So this machine here, it's a cautery machine.
Oh.
If you have a blood vessel that is bleeding, it uses a small electric current to close the end.
Oh, so it stops the bleeding.
Stops the bleeding.
Right. So that would be very important, that if a mother was bleeding too much, they could actually stop it right away.
Correct.
Well, that is fascinating, and I think that this role as surgical technologists and what they're doing for the patient to make sure that it's infection control and safety, and this is a really great job. Thanks so much for joining us today.
You're welcome. Thank you.
Oh, cool. Hi, Stephanie. My name is Erin. I'm with the Osceola School District today, and we're filming here at the Baby Place, highlighting different jobs. And so I was curious, I'm guessing that you're either a unit secretary or a health unit coordinator.
Health unit coordinator and secretary, same thing, just fancy names.
Can you tell a little bit about what your path was to get to this particular job, and maybe a little bit about what you do every day?
Well, I have been doing this for the past 12 years. Graduated high school, I went to college. I got my associate's degree in healthcare administration. But just with a lot of experience, it's very easy to become a unit coordinator.
Awesome. And so what do you do here for the patients in the Baby Place?
So once they come in, I help the nurses put in some orders into the computer just to kind of make it a smoother process for them once they're in the rooms with the moms, getting them admitted and everything. When they come for C-sections, also the same thing. We schedule for epidurals, we put it in the computer, and I put charts together, get medical records, again, making it just easier for the nurses.
And I see there's lots of phones, so I'm assuming that answering the phones is a big part of your job.
Answering the phone is a lot of it, yes.
Are you answering patient phone calls?
Patient phone calls as well, yes.
And then maybe phone calls that are coming in
From
other places in the house?
Everybody, family members wanting to know how the moms are doing, how babies are doing. We receive phone calls from patients whenever they need something, and then we just relay the message to the nurse. And that's pretty much it. We keep the unit secure as well. That's one of the biggest things. Just lots of cameras, making sure that everybody that's supposed to be in the unit is here for that reason and no other reason. And
protecting patients' safety and baby safety.
And keeping our babies safe. So yeah.
So what would you say is the top 3 skills if I'm a high school student and I'm getting ready to graduate and I want to be a health unit coordinator? What do you think that I need to make sure that I can do?
So customer service. I'm always making sure that when you pick up the phone, your voice is as happy as can be, because even if they can't see you, they can hear that you have a smile on your face. And just clerical duties, so computer duties.
So computer skills are pretty important in this job. Yeah. Do you have to type a certain amount of words a minute, or?
No, I'm a pretty quick typer, but it does help whenever the unit is pretty busy. The quicker you can move and move your mouse and type away, then the faster you get things done, especially under pressure.
Great. Well, thank you so much for letting us see a little bit into your job and what you do here at the Baby Place.
Thank you for having me.
Hi, students. Well, so we're back again, and we're here with Dr. Watson. And Dr. Watson agreed to be able to interview about how she got to be in her role here at Advent Health, the Baby Place. Hi, Dr. Watson.
Hello.
Can you tell us a little bit about your career path and what made you decide to be a doctor here?
Yes, I can. My name is Dr. Brenda Watson. I have been an obstetrician gynecologist for about 35 years. Went to medical school in Chicago, and as soon as I did my obstetrics and gynecologic rotation, I fell in love. I think OBGYN encompasses all of the areas: pediatrics, gynecology, obstetrics, surgery, and medicine. So it was a well-rounded area, and I fell in love with that. Initially, I was in private practice and decided that as a mother of two and wife, that I wanted something a little bit more steady. So here at Advent Health, I'm what's called a hospitalist, which is shift work. So we work day shift, either from 7 a.m. to 7 p.m. or 7 p.m. to 7 a.m. We cover labor and delivery 24 hours a day, 7 days a week, 365 days a year. So that patients that need health care that do not have an assigned physician is seen by a physician immediately, as well as taken care of in terms of their labor course.
Great, and so thanks for explaining all that to us. We often students ask, I really want to be a doctor, but I really don't understand what are the steps that it takes to get there. Like, how many years did it take you from the start of when you left high school to the finish time? Like, how long was that process?
Well, certainly you have to graduate from high school.
First step, right?
First step, maintaining good core courses and a good grade point average. From there, college. Deciding what your major. I certainly majored in biology in college, but certainly chemistry and other areas.
So some type of science is usually
Correct.
the path.
Correct.
Okay.
And 4 years of college, and then from there 4 years of medical school. Attended Chicago Medical in Chicago, Illinois. It was a 4-year program.
And did you have to apply to medical school?
Yes.
So it was a
Yes.
whole other application.
Well, just like you apply to college, just like the application process. Certainly, you are accepted into colleges based on test scores and based on grade point average, and certainly personality-wise with interview situations. And medical school is basically the same way in terms of testing.
So that's 8 years. So now can you go out and be a doctor then?
Well, certainly at that particular point, usually once you finish medical school, you decide what you would like, what area of medicine you would like to go into. And depending on what that area is, there are residency programs to specifically train you in that area.
Anyway, so we were just talking like 8 years, and then you go to residency, where you're going to specialize in what you want. At that point is when you did OBGYN?
Yes, and the program I attended Howard University Hospital in Washington, D.C. At that particular time, my residency was a 5-year program. The first year of an internship where you rotate through all of the departments: emergency room, medicine, pediatrics, OB. And then the last 4 years were strictly OBGYN training. But each individual specialty has different requirements for their residency. And then, let's say you wanted to go into orthopedic medicine. They may have a particular fellowship after the residency where you would train in knee replacement or shoulders or hips and that sort of thing to become more specialized. So it just depends on what area of medicine you want to go into.
And the importance, I think, too, for students to understand that we all continue to learn. So even, how long have you been practicing now?
35 years.
I'm sure from the first year of when you were practicing to now, all the knowledge you've continued. Doctors have to continue to do training along the way. It never stops, right?
Absolutely. You have to stay current on latest treatments, technology, advancements in our particular field.
So if you had one word of advice to students who are in high school who are considering entering a pre-med program next year, what would it be?
I think it would be consistency Stay the course. Be determined. Don't give up. There'll be times when you'll feel like you can't handle it anymore, but don't give up. And at the very end of that rainbow is a very rewarding area that will be very fulfilling for the rest of your life.
Thank you, Dr. Watson, for joining us today.
Absolutely. My pleasure.
My name's Aaron. I'm a nurse anesthetist here for USAP, affiliated with Advent Health. I've been a nurse anesthetist for about 3 years now. I started as a nurse. I became a nurse about 7, 8 years ago. I'm from Michigan originally. My whole path in medicine started in the ER. I worked as a tech in the ER, putting IVs in, doing EKGs. From there, I just started seeing how nurses were working. My mom's a nurse, my sister's a nurse, so I just kind of was always around that field. So I decided when I applied to college to go into nursing. Once I became a nurse, I stayed in the ER, the same ER I was working in. While I was working as a nurse, I saw a CRNA come down, or SRNA, which is the students training to go into CRNA school. I saw them down, and I wasn't quite sure what they did, so I asked questions. I went into shadow one of them, and I was like, wow, this job's awesome. So I decided I wanted to do that. So I worked in the ER for about 3 years as a nurse, and then I worked critical care, cardiothoracic ICU, which is after heart surgeries and heart stents and whatnot. I did that for 2 years, and then I applied to anesthesia school in Miami. I went to FIU. For anesthesia school, you have to have critical care experience as a nurse. Typically a year, 2 years is preferable. It's very competitive to get into. You have to have really good grades. You have to be really involved. Try and be involved as much as you can. What really helped too is the shadow. By shadowing someone, I went in and saw a couple surgeries. I came home and I made notes about what I saw. I tucked them away. And then as time went by, and I had to go interview, they asked me, how do we prove to us essentially that you want to do this? And I was able to have those notes that I took 5 years ago, like, well, these are people I shadowed, this is what I saw. And they were like blown away that I spent the time to do that. So you really need to make yourself stand out in a crowd because it's very, very competitive. Anything you can do is to stand out for it will help. It's a great career. I love what I do. A lot of flexibility. You can work labor and delivery, you can work pediatrics, you can work neurosurgery, thoracic surgery, anything you want to do anywhere all over the country. You can work independent contractor, you can work W-2 with just working like a standard job. There's 8-hour shifts, 10-hour shifts, 12-hour shifts. Really, the sky's the limit with the job. Yeah.
So students, this job is great. So this is an extension of beyond nursing, and it's part. First part was nursing,
Correct.
and then it was really specializing in anesthesiology.
Correct.
And so you are really responsible in this unit, in the baby place, is making sure mothers want pain relief during labor and delivery, or if they're having a C-section.
Correct.
That you are actually the one who's administering that medication to actually help them to numb basically the areas that they're feeling pain.
Correct.
And so that specialty, so from the start of your RN, if I wanted to go in and do that whole thing, how long would it take a student to become a nurse anesthetist?
So the first thing you have to do is get a nursing school. You have to get at least a bachelor's degree. There's some that have, the associate's degree. You want to get a bachelor's degree. That's typically 4 years, plus or minus. It's a bachelor's, so it's 4, but sometimes you have to do the prereqs, get a little bit extra. From there, you'll do your rotations through OB. It won't really be anything anesthesia-wise or anything, but it's the nursing realm. From there, to go into anesthesia school, you have to have critical care experience. So if you come out of nursing school and you just work OB or you work on any floor that's not critical care, like ICU is really the best thing you need. You need at least 2 years of that. So you have nursing school, 2 years of ICU, and then you apply to anesthesia school. Usually the application process is it can be kind of long, 6 to 8 to 10 to a year and a half by the time you get all your papers out.
But during that time, you're working as a nurse.
I'm working as a nurse the whole time.
You're working as a nurse the whole time.
Exactly. So you're working as a nurse while you apply, and then once all their paperwork's done, then you start school. Once you're in school, you can't work. So that's a whole another 3 years, 3 or 4 years, because most anesthesia programs are now doctorates. So it ends up being about 3 years, almost 4. And the tough part of that is during that time, you actually can't work. Just by all the schoolwork you have to do and clinical work, there's really not much time.
And then the last thing, my question for you is, you said something very important at the beginning, that you worked as an ED tech first.
Correct.
Is that when you were in the beginning of your nursing school career?
Yes. So that was actually a fun story. I was working as a server at Texas Roadhouse, and I guess I took really good care of one of the customers, and he asked, what my plan is, and I told him I wanted to go into nursing. And he was like, well, I happen to be the manager of the emergency room, so if you want looking for a job, let me know. So that's kind of how I got into that. But by all means, if you wanted to go into medical, anything, whether it's nursing, respiratory, getting a job in a hospital really, really helps, because if you think you want to do one thing, by the time you get in the hospital and you start seeing other avenues, other things that exist, it really opens your mind of, wow, maybe, I always wanted to be a respiratory therapist, but now I got to see what a radiologist does. Maybe I want to do that. And there's things that you don't even realize that go on until you actually work in a hospital and you see the ins and outs of how things are ran. So I think it really helps if you have an inclination to go into the medical field, to try and get a job doing something.
Well, thank you, Aaron, so much. And
course.
Happy Nurses Week. We really appreciate everything you do for patients
Awesome.
here.
Thank you very much.
All
Good luck, you guys.
Bye-bye.
Thank you.
All right, so we're still at the baby place, and boy, have we run into the most unique job that I've ever been into. And this is Jocelyn. And Jocelyn tell us a little bit about who you are and how did you get to do the job that you are doing today. And I'm so excited to see what you're going to show us today.
Of course. My name is Jocelyn. I'm the tissue recovery specialist with placental donation. Basically what we do is we collect placental tissue from moms who have had cesareans and had C-sections.
What's a placenta?
What's a placenta, you say? A placenta is a tissue that is created once the baby is born, okay? Once the baby is in the tummy. So that tissue, they're able to take in oxygen, they're able to have food in them, and that's how moms are able to feed their babies.
Right, so it's actually this organ, this tissue is actually feeding the baby while the baby's inside the uterus.
Exactly.
And then at birth, it's not needed anymore.
Exactly.
And so your job is to actually ask mothers their consent, is that right?
Yes, exactly.
And then you collect that tissue, the placenta.
Yes.
Is the umbilical cord attached too?
Yes, we collect it with the umbilical cord because we use 2 different regions of the placenta to create different things from it.
Great. Well, go ahead and get started in what you're going to do, and then I'm going to ask you more questions along the way, if that's okay.
Of course. Right now I'm going to be applying my sterile gloves. We need 2 sets in order to handle the placenta and make sure it's sterile throughout the whole entire process. And my hands are already clean.
So sterile means that the environment that you've set up is to make sure that there is no microorganisms that could possibly touch what you're doing, correct?
Exactly.
So it's beyond just hand washing.
Exactly.
I have a question. Why 2? Why 2 sets?
So there is 2 different processes when we place the placental tissue into our sterile bags and into our bucket. We do have to come in contact with the tissue. So once we come in contact with the tissue, we're sterile. But once you grab that placental tissue, we have to grab something that's non-sterile. So we have to remove those non-sterile gloves.
So tell us about your career path. Start back in high school. How did you get to be this job that you're doing today?
Well, I actually went to a technical high school, and in that technical high school, my healthcare pathway was becoming a nursing assistant. And I was a nursing assistant at the age of 16, very young. I was very happy that I was able to choose that pathway because of my technical school.
That's great. And so you're CNA, and then you graduated high school. Then what did you do next?
I received my bachelor's degree in medical biology and a minor in chemistry, and I went to a state school.
Great. And so then you left there, and what was your first job after that?
My first job was doing science presentations at Epcot here in Florida.
That's really cool.
Yeah, it's looks. It has the umbilical cord attached and the amniotic membrane around the placenta. We take the placenta and we place it into our sterile bags. Then we touch our non-sterile saline, and this just preserves the placenta. And we try to do this within the first 24 hours of delivery so we can preserve the whole entire tissue.
So how old was that placenta that you're just doing?
Exactly 22 hours. So just yesterday. And then we have to tie it up with everything on this plate is sterile. So we just tie it all together with our sterile zip ties.
So sometimes there's some misconceptions about organ donation. And so why is this important for mothers to donate their organs? Who is this actually helping?
This is helping patients that are in need, such as diabetic patients or open ulcers, open wounds, any type of wound care emergency cases, and also anyone that is a burn victim. The majority of the cases that we help treat are burn victims, and those cases are emergency cases that come through the ER.
So this tissue, because it's filled with such great nutrients, right? It still has those properties to it. They can usually take that tissue to actually help those diabetes patients' wounds to heal, or for burn victims to heal, because it's sort of a miraculous tissue, right?
Exactly. So around the placenta is the amniotic membrane, of course, and within that amniotic membrane, it has what's known as growth healing factors, which is why the allografts are created for those specific patients.
What was that word you just used?
Growth healing factors.
Growth healing factors and
Allografts.
allografts. So
Yeah.
they make allografts
From the amniotic membrane that surrounds the placenta.
and those grafts are then used to treat patients.
Exactly. So what we do is we dehydrate the placental membrane in a certain scientific process called the Curion process. It dehydrates it, takes all the blood away, and it dehydrates in a system for a few days. And once it's done, it looks like a clear sheet of paper. And that paper, or that allograft now, can sit on shelf life for up to 5 years without being refrigerated, frozen. The doctors can just take it and place it on the burn victims.
That is miraculous. That's
Yes.
really a great thing, and helping obviously so many patients.
Of course.
So this organ donation by mothers is very, very important for saving lives.
Yes, of course. I'm just going to grab some gloves.
Sure.
And now we just place the placenta in the fridge. It's important that it stays refrigerated at all times, so we just put it back in the fridge, and I clean up here, and my process is done.
Awesome. Well, thank you, Jocelyn, for letting us see a little bit about your job role. And tell me your job role name again.
A tissue recovery specialist.
A tissue recovery specialist.
Mhm.
Thank you so much for your time today.
Of course. Thank you so much.
All right.
Thank you.
Bye, students.
Bye.
Hi, students. So we are in another area of the baby place, and I'm joined with Jill.
Hello.
Hi, Jill.
Hi.
Can you tell me a little bit about your role here in the baby place?
Okay, sure. So I am what's called a NICU nurse, and that's an acronym that stands for Neonatal Intensive Care Unit. We are a 10-bed unit here at Celebration. And what we do is we take care of babies that are born either premature, where they are very small, or are sick when they're born.
Okay, so that's a very specialized care. And so what is your role? Are you a nurse?
I am. I'm a registered nurse.
You're a registered nurse. And did you have any specialty training to be a NICU nurse?
So we get training on the unit. In nursing school, we only had an observation on the unit, and that's what we do here. It's observation only when we have nursing students that come through.
Okay. And if I'm a patient, so I'm a mom and I've had a baby, is the mom stay with the baby while they're in the NICU or no?
They can stay with the baby. So these are single private rooms, We have a bed here, or a chair that folds out to a single bed, and we have the recliner, and we also have a bathroom over here. Behind you is a shower and a bathroom for the parents to
So
use.
is it still considered that the mom and the baby are patients? Only the baby is the patient here.
Only the baby. That would be after mom is discharged from the mother-infant unit. Then she could stay with the baby if she chose to. A lot of our parents have other children at home or have things going on, and mom's healing as well. So sometimes they'll go home and spend the night in their own bed and take a shower in their own place and come in and spend the day with their baby. But they do have the option if they do want to stay.
Great. We have some highly specialized equipment in here that takes care of these babies who are born early, or they may be sick when they're born. Can you tell me about what this is called?
Sure. So this is our isolette, or Baby Leo is the name of it. And what this does is it provides heat for the babies that are premature, or that might be breathing very fast, and we want to have them in an enclosed environment to be quiet, or things like that. So it actually has multi-functions. So when babies are really small, it actually heats them in the isolette, and then as they wean to an open crib and they're able to gain weight, gain more body fat, can maintain their own temperature, then we can open this up, and this becomes just like an open crib to prepare them for discharge.
Does it monitor like their heart rate or?
So no, this one does not. What this monitors is simply their skin temperature.
Okay.
It has a bed scale. We can weigh the babies right here. We don't have to take them out. This is our monitor that would display the heart rate, respiratory rate, and oxygen level. So they would be hooked to this monitor the whole time they're here in the NICU.
And I'm noticing too that you have some other devices here. I'm assuming that is for breast milk.
Correct.
So mothers can actually still they can actually pump their milk and still be able to feed these little babies who may not be ready to breastfeed in the more typical way.
Correct. So like we say, breast is best. For those that can breastfeed and provide breast milk, of course it is gentler on the premature baby's stomachs. It's preferred if possible. So if the baby's too small or is having respiratory issues and cannot actually nurse with mom, then mommy has the bedside breast pump that she can pump her milk, and we can give the baby through a tube, so that at least the baby is getting the benefits of the mom's breast milk.
So that's really nice to have all that coordinated care all in one spot for these very specialized care for these really small infants. And so how many babies do you normally have in the NICU at one time, or how many babies do you have on average per month? Is it a lot, small number?
I mean, average, I would say we're averaging about 6. Sometimes we have 8 or 9. Sometimes we have 3 or 4. Today we have 5. So it is, like I said, a 10-bed unit. We have 6 single rooms, these private rooms, and then we have a bay with 4 beds in the bay. It's an open area, and that's where we tend to have the sickest babies so we can better observe them. And as well as new admissions, we tend to put in the bay as well. Once they get stabilized, then we will bring them into a private room.
Well, thanks so much for telling us a little bit more about the neonatal intensive care unit, or the NICU, here at Advent Health Celebration. Thanks so much.
All right, thank you.
Okay. Thank you, everyone, for another wonderful behind-the-scenes VirtuLIVE tour here at the Baby Place.
We've got to see many different roles, and I'm hoping that you get to enjoy and understand that the Baby Place is a place where there are lots of opportunities in different career fields that you can get into. And Candace, thank you so much, and happy Nurses Week to everyone. We really appreciate everything that you do.
It's my pleasure, and thank you to every staff member that agreed to be interviewed for this